Welcome to CONNECTEDAZUSA. Throughout this series, we'll connect you to citywide and regional resources on the topics of health, wellness, and sport. Your host for this series will be me, Nathan Nunez, and a pretty awesome dude named Sonny Cravens. Both Sonny and I work for the City of Azusa's Recreation Division. Dr. Laren D is a medical doctor who practices at Loma Linda University Health. He is an expert in the fields of pulmonary and critical care medicine. Dr. Tan has authored numerous journal articles in the field of obstructive airway diseases, critical care, and medical innovation. He is also the current president of the California Thoracic Society and a contributor to many organizations, such as the American Lung Association statewide. We hope you enjoyed this series and encourage you to like, comment, share, and use the on-screen hashtags. Please let us know in the comments if you have any suggestions for show guests or any questions. Now let's get started.
Hey everyone, I want to say thank you to Dr. Tan for joining us today. We appreciate him taking time out of his day to basically come on and talk to the community about, what's going on in the world today. This is Dr. Tan. This is also Sonny with us. Sonny works for the Azusa Parks and Recreation, and so do I. My name is Nathan Nunez. Dr. Tan, would you like to introduce yourself?
Yes. Thank you, Sonny. Thank you, Nathan. Thank you, the City of Azusa, for giving me this chance to be able to educate and be able to speak to you about COVID-19, everything that's going on. As what Nathan has stated, my name is Laren D. I'm an associate professor at Loma University Health. I am a pulmonologist, or we could say a lung doctor. At the same time, also work the intensive care unit, taking care of the most critically ill patients. Along with that, I am the director of our comprehensive program for obstructive airway diseases at Loma University Health. I'm the president of our California Thoracic Society, which represents a lot of different respiratory healthcare providers all throughout California, and also work very closely with the American Lung Association.
Sonny, would you like to go ahead and get started?
For sure. Thanks, Nathan. So the first question on our list here is, so what is a virus? We hear the coronavirus. I know it's COVID-19, but commonly known as coronavirus. So what is a virus? How does a virus interact with our bodies?
Right, that's a great question, because a lot of people want to be able to understand what's the difference between a virus and perhaps even a bacteria, right? Well, viruses and bacteria are both infectious agents. They both need a living host to be able to replicate, to be able to continue on living. The difference between a virus and a bacteria is that a virus essentially needs something to live in order to replicate. And the best way that I could think about this is, imagine we've all seen these space movies where an enemy ship docks on to another ship, and then the bad guys infiltrate the host ship and take over that ship. And that's essentially how a virus actually works, versus a bacteria, where a bacteria can by itself start to replicate. So for COVID-19, it is able to be able to enter the host or enter the human body through either the mouth, the eyes, the nose. And once it gets in there, it attaches on to the different cells, and they're able to start to take over that cell and cause a lot of various different problems within the body itself.
So you brought up the difference between a virus and a bacterial infection, and when you hear antibiotics, is that why we're not able to combat the coronavirus with things like antibiotics, because it's not a bacterial infection?
That's exactly it, Sonny. That is the difference also, that we've got antiviral medications to target specifically virus infections, and then we've got antibacterial medications that target bacteria. And one does not necessarily treat the other. They're for specific infection types.
For sure. And then, so is that what makes COVID-19 so different from viruses that we faced before, is because it's so new, we don't have an antiviral for it yet? Or are we, I guess what I'm asking is, what is COVID-19 and why is it so difficult to combat?
I think you touched on it right on, Sonny, initially by saying that this is something new that our body's experiencing. So we've never, within our body, we've got memory to be able to figure out how to fight various different infections. And since this is something extremely new, we could say that the body's immune response is going to be very different. It may be actually more robust, and so we may feel even more ill because we don't exactly know how to target or kill this specific virus. Interestingly enough, it's very important to know that there are 4 common coronaviruses that is not, as we could say, as severe as what I will better identify as now the SARS-CoV, which means severe acute respiratory syndrome due to a coronavirus. Now that's the SARS, and then there's the CoV, which is coronavirus. And we have to realize that these 2 SARS-CoV have been known to really cause a lot of problems within the lungs, and also can cause severe illnesses. To give you more perspective, so SARS-CoV or coronavirus itself, there are 3 that is very well known that actually can cause a lot of, we could say, a lot of severe respiratory diseases. The first one was identified in 2003 back in the Guangdong province in China. And then the second one, what we also know as MERS, which is Middle East Respiratory Syndrome, which was first identified in 2012 in Saudi Arabia. And then now we've got SARS-CoV-2, because this is the second one, which is identified in 2019 from Wuhan, China. So that's the reason why a lot of us, or you may hear SARS-CoV-1, which was the one identified in 2003, and then now this is SARS-CoV-2, which is identified in 2019.
So have we taken any past research on what happened in 2003, and is that kind of helping us out right now?
I think looking back at what we've done in 2003, what has worked is definitely being tried to be applied now. But these are 2 different, we could say 2 different cousins, and they may react differently. So it's hard to say. But I think a lot of the practices that we learned in 2003 is definitely being implemented now in 2019.
So next question being here, how is, you kind of touched on it in the first question, how it's spread in the nose, the mouth, and the eyes. So what about the nose, the mouth, and the eyes that makes it so easy to spread through that?
How COVID-19 is spread, we know right now at this point, is that it is through droplets, through little small droplets of moisture that you and I, when we sneeze or perhaps rub our nose, there's a lot of viruses shed in that. And then when someone else touches it, or you touch it, or it goes in, or this droplet goes in your nose, you inhale it, or in your eyes, or in your mouth, that is then a way to get into your body. I think a lot of the question that has been put out also is that, well, if it is, let's say, on a surface, how long is it going to be on the surface before someone else comes and touches it, and then they too become infected? Or how long can the virus stay alive outside of the body? That we're not really too quite sure right now. We realize that it could be alive from hours, and some have even quoted to days. But I think what it really depends upon is that surface type. If it's really porous, it's something that absorbs the fluid. Is it a hot surface? Are there nooks and crevices? All those things can affect how long the virus is going to stay viable in that little, we could say, little droplet.
And could weather play a factor in how long it stays around on a surface? So I'm hearing the buzz about it being maybe a seasonal thing.
You know, I think first and foremost, we're not entirely sure right now. I know the NIH is looking at it. There's been a lot of hypotheses that warmer weather may not actually affect it. If it does follow in alignment with its cousins previously, perhaps the warmer weather will stop it. We know that humidity can affect also how it's spread and how maybe lessen it. I don't think we're actually really quite sure right now. I think what we are sure about, though, is that by social isolation, by being responsible, by really just being practicing great hygiene. Those are the best practices we could do to help prevent the spread of COVID-19 moving forward.
So you talk about things that we are for sure about in social distancing ourselves, practicing good hygiene. Um, we're pretty concrete on what the symptoms of COVID-19 are now, right?
I think that we have identified specific symptoms, and also we've looked at different imaging. We've definitely got some very, specific tests that's able to identify if you do have the infection. But the more common symptoms that has been identified with COVID-19 is having a fever, and that's typically, having a temperature greater than 100.4, but some have even said as low as 100. But what we've seen at bedside is that these fevers can go up to 101, 102, 100, and even some at 103 that have been reported. So the temperature range varies, but nonetheless, a lot of people do actually experience having significant amounts of fever and also significant amount of shortness of breath. In addition to that, some have actually talked about having chills, sore throat, sneezing and coughing. But as you can see, as what I'm telling you, it's very non-specific from the common flu or even seasonal allergies that you might be experiencing.
Right. So you'd be able to tell if you have the flu as opposed to having COVID-19.
I think that's actually very difficult to be able to tell. And that is one thing that a lot of healthcare providers are struggling with because the symptoms overlap. They really do. They overlap, especially now in springtime. It's hard to be able to tell if what our patients are calling in is really the seasonal allergy that they may be experiencing. I mean, there are key things, right? Seasonal allergies is not associated typically with fever. It is not associated with perhaps some GI symptoms that some people may be experiencing with COVID-19. Let alone also people with seasonal allergies should really know what their triggers are. Granted, that be whenever they're exposed to pollen or they're exposed to grass. Every time they go outside, they tend to have more runny nose, more sneezing, more coughing. That tends to more suggest that there is a specific trigger that would support seasonal allergies being the cause of those symptoms. Granted, if you're at home and you're having fevers, really feeling fatigued, tired, experiencing profound shortness of breath. And what do we mean by that? Being short of breath, just walking to the bathroom or walking to the bedroom, that is just not typical for you. That tells you that something else is going on. Given that it could be the flu or it could be COVID-19, that's the reason why we want our patients to really seek medical attention sooner rather than later, or contact their provider to let them know the symptoms they're experiencing.
So how soon should you seek medical attention if you start having those concerns, a high fever, shortness of breath?
That how soon to seek medical attention is an extremely hard question to be able to put as a blanket statement to everybody, because each individual is different. So for example, if you've got someone who's got chronic respiratory disease, whether that be asthma, COPD, let's say lung cancer, pulmonary fibrosis, if your asthma is not controlled, if your COPD is not controlled, or your lung disease is extremely severe, we've been telling our patients to really let us know much sooner rather than later, because we would rather be ahead of the game rather than trying to catch up. And a lot of times, this also allows us to make sure and keep a close eye on our patients while they're at home, because the last thing we want is for them to go to the urgent care or the emergency department unnecessarily and then end up catching an infection that they didn't have previously.
Right. All right, Nate, I'm gonna turn the bill over to you.
Cool.
So we just kind of touched on this, Dr. Tan, but if you have a kid who's asthmatic, what precautions should they be taking?
Oh man, asthma and COPD are probably one of the two most common, we say, chronic respiratory lung disease, and asthma being more prevalent among younger kids. And also now we're starting to see is also perhaps even in adults as their adult onset asthma that may be coming on. But the number one key factor is to make sure it's the best of our abilities to be able to control their asthma symptoms. Being able to control your asthma prior to being infected really gives you a lot of reserve to be able to handle that infection. So how can parents or even those who are suffering from asthma do the best that they can to prevent from getting a serious effect from COVID-19? And that is, one, if you're on your chronic maintenance inhalers, to continue to make sure you keep taking them. Two, to make sure you also have your rescue inhalers available to make sure that you're ready to go. And three, really avoid as much of the triggers or allergens that actually cause you to have asthma symptoms. So I think those three things will help out our asthmatics to be able to be better ready if the time should come that they end up getting infected either by COVID-19 or even just a regular flu or any infection.
So on that same topic, if someone has an autoimmune disease or a weak immune system, are they more susceptible to COVID-19? What are your thoughts on that?
Right now, at least what the data is supporting is yes. And even before COVID-19, this was something that we saw even with the common flu, that after an infection, whether it be with the flu or even now with the COVID-19 infection, patients were more prone to get a secondary infection, whether that be bacterial or another viral infection. Patients who are immunosuppressed, whether that be an immunocompromised state, due to, let's say, chemotherapy, or let's say they're on a rheumatologic drug, or let alone an autoimmune process, does make it so this way the immune system is compromised to fight off the COVID-19 infection. So for those patients, what we've been telling them, or what we've told them in our clinic, is to really have really close communication with your provider, whether that be your rheumatologist, your pulmonologist, or your primary care physician, to let them know if things are changing or if things are actually worsening. We wouldn't say to stop the medication that is needed to control their current disease. So for example, if someone's got rheumatoid arthritis, we wouldn't want them to stop their rheumatoid arthritis medication in fear of the COVID-19. In fact, what we would tell them to do is practice even to really practice more or less hypervigilant social isolation and being away from those patients that are actually sick. For our pulmonary patients, this is something that they've actually been practicing even before COVID-19 came about. Every year when the flu season came about, we were already educating them, hey, flu season's coming up. It's time for you to stay away from those that are sick. Anywhere you're going, either to doctor's offices, or even if you had to go to the emergency room, make sure you wear your mask, make sure you wear your glove, don't touch your eyes, because we knew that they were at a state that would perhaps actually put them more at a heightened risk to have complications from getting another infection.
So if one of our family members did get COVID-19, what do we do? Do we continue to stay active? Do we get a lot of sleep? What should we do in the event that we did get COVID-19?
I think the really promising thing right now is that the majority of patients who actually have COVID-19 end up doing well. Unfortunately, media has really highlighted on the worst case scenarios, but there are a lot of COVID-19 patients who also have asthma and perhaps even COPD also that have actually done well. That being said, it just depends on the degree of control they had prior to actually getting the infection. So if, let's say, an asthmatic whose symptoms have actually been very well controlled ends up having COVID-19, the likelihood of them actually recovering is actually very high. What we would say is, be at home, continue to use your maintenance inhalers if you need it, contact your provider, stay hydrated, eat healthy, definitely isolate yourself so this way you don't infect the rest of the family as much as possible. And practicing good hygiene also at home are the key things that can be done for that asthmatic that's infected with COVID-19.
So as a community, what can we do to continue to flatten the curve or slow the spread?
I'd say, and this is from me just living in it, seeing it, even in our city, being at the bedside. I think the biggest thing for our community and even for the city of Azusa is to practice common sense. Really, that's one of the most number one thing I would say is to practice common sense, be responsible, not being around those that are sick. And if you are sick, really isolate yourself, right? We've talked about being responsible as social distancing, sheltering at home, not going out unnecessarily unless you absolutely need to. And if you do, then wear your mask. Practice great hygiene, both outside and also at home too. And then I would say also a part that really needs to be promoted is putting your energy towards positive things. I think a lot of us have stayed at home and have been continually watching the media, and that can be very depressing because there hasn't been a whole lot of positive news as of late. And so I think there's one thing to stay up to date with what's going on, but it's another thing also to remember that we will get through this, and that I need to do something positive with my life so this way I don't get depressed while just being at home. And then showing acts of kindness to our community, to those around us, I think will really help us to boost up our morale and take us out of this depressive mode right now. And I would say last thing too, Nathan, I got to add this in. This is more than ever the time to remember why it's so important to make healthier choices. I think for us to be able to make sure we're eating healthy, exercising, because if we were doing this continuously, we would be in a much better state to be able to fight off any infections, whether that be COVID-19 or the next new bug that comes out. And so that is what needs to be done right now for us to realize that as a community, if we are healthy, we're going to be that much better off to fight off the next COVID-19, COVID-20, or whatever infection that comes up.
As we come to a close here, what resources can we highlight for the community to go to for more information or if they have any questions?
Our Center of Disease Control in the United States have done an excellent job, so I think that is one great site to be able to look at. For those suffering from chronic lung disease, the American Lung Association has also got great resources too. Loma Linda University Health has put out a bunch of different things. And then for healthcare workers, I would say that is seeking out information to help better educate, to be able to educate themselves. The California Thoracic Society has a COVID-19 resource page. In addition to that, the American College of Chest Physicians and American Thoracic Society. Those are all great resources to be able to look at that pertain more towards the United States, that also pertains more towards California. I guess one thing I didn't emphasize was it probably would also be good for families to plan ahead, meaning that even right now, the thought process perhaps should be, if one of our family members got infected with COVID-19, what would we do? Okay, we would turn the downstairs room or this room to be the room of isolation where they would stay. And this would be the bathroom they would use. All their toiletries would be separated. All their bowls, cups, plates, everything would be separated. It's almost like an earthquake plan, right? That we commonly promote, or even a fire safety plan. I think something needs to be similarly done for COVID-19 too, because in this way, when we do get that positive result, you're ready to go. Everybody's ready to go. They know what they need to do.
Well, thank you again. We really appreciate it. Our community is definitely going to appreciate this very much. These resources to be able to talk with the medical doctor who's actually working with these COVID-19 patients is something that's is really special. And we appreciate you coming on. And yeah, thank you. Thank you very much.
Thank you for having me.
Thanks so much, Dr. Tan.